I'm going to transition to education. And we know there's all kinds of things we can talk about in education. There's EAA, there's the emergency manager. I'm going to limit it to talking about the budget and funding. And you hear, was there increase in funding? Was not increase in funding? And so that is debatable. So I'm going to show you a graph that shows you what's happening in Michigan. I don't think you can see that.
No, you're fine.
Okay, and so in 2014, per student amounts were $7,076. So the 2015 budget year is increased to $7,251. So on a sliding scale, students will receive, or school system will receive money. The minimum has to be $7,251. Detroit in 2014 received $7,246 per student. They will get a $50 per student increase, which will make it $7,296. Let's say Battle Creek. Battle Creek last school year was received $7,118 per student. They'll get $133 in order to bring them up to $7,251. So every area is different, and then there are also equity payments. There are also competitive grants. I'm just dealing with the basic foundational. You hear a lot of things about the foundation dollars. These are foundation dollars that each student receives. So you see that. So look back to 2009. It was $7,316. Now that does include some air dollars. This map doesn't even show you index to inflation. So we're lower than what we were in 2009. If we put inflation in there, it'll be so out of whack. So education funding really lacks in Michigan. And so what is their answer to that? Some of their solutions they've come up with. Well, some say we're paying for legacy costs. That's another discussion too. What's getting to the classroom is a lot of times I look at. How are the kids, what results in the kids' lives and the students' performance with that? And so for Michigan, you can see that I have a chart here that shows you, the dark red line is Detroit, the green line is Michigan, and the gold line is outweighing. So you can see that in the Detroit area, students are struggling to reach those milestones. And so let's say, for instance, in fourth grade reading, which is actually third grade reading, they don't test them to the fourth grade, beginning of the fourth grade. You see that 60% of Detroit students are not proficient. And each of these categories is not proficient in eighth grade math. So you see those that were struggling to meet the milestones. So one response that the state is doing is they want to retain students who are not proficient in third grade. Now, evidence shows that does not work. Keeping kids back is not the solution because you don't have any interventions. Intervention needs to come before prevention. And it's House Bill, if anyone wants to look, House Bill 5111, we think that's going to have traction in the fall. So we're watching that closely. In Florida and Ohio, they both have those models, but what they have done differently, they have resourced intervention. They have funded intervention that provides for students before intervention. Now in Michigan, there's a couple of legislation that's been added to it, but it's not funded. And unfunded mandates don't help. So you can't say a school district, well, here, retain students and do this intervention, not give them any money. And so it needs to be more thoughtful. And we testify, and part of the things that we do is we testify in front of the hearings, and we testify showing the problems with this. What happens is that they will end up being retained, and they're retained again, and then if they are eventually passed along, won't graduate. And so the success rate for programs that don't provide intervention have not been successful. And we're hoping they actually look at evidence and not just think this should work. We'll retain them, and we'll make sure their families or something like this do their part. So it's not a good solution or a model for that. And one part I'll mention is that in the last school year, 48 schools had deficits. 48 schools had deficits. That's huge. I'm transitioning to health, and this is connected to education. One of the things about students is their attendance. And there's many things why kids are absent. Asthma is really high, environmental issues in this area. But I don't know if people realize the number one chronic disease on children is tooth decay. Number one. And so Michigan has a healthy kids dental plan. Now, in 2014, there were 78 counties that were on this plan. In the 2015 budget year, they added Kalamazoo County and Macomb County. And there's still 400,000 children that are not included. Can you guess what counties those are? Wayne is one of them. And the other two are Oakland and Kent. In Wayne County, that means 167,000 students or youth, children, are not receiving the healthy dental. And what happens with the healthy dental is that it provides additional payments to dentists in partnership with Delta Dental. And so dentists receive payments from Delta Dental, which makes them more likely to join the program. And the cost would be $23 million. I think, one of the senators, Johnson, and some others, I think, have been introducing things for this, but it'll be $23 million. And kind of think about it, if you think about the state budget being $52 billion, that's actually a rounding error. So where are the priorities and where should they be? So now I want to into some good news. So some good news is the Healthy Michigan Plan, and that is the Expanded Medicaid. And they had projected that 322,000 people will be enrolled. As of September, 15, there were 385,000 enrolled and 57,000 were in Michigan. That's been a success. We actually show already a 0.5% reduction in uninsured. So this is a successful program. So there are good news and good things happening. We have to focus on that. We did advocate for those things and we did get them. So we want to share both how they've hurt and how they've helped families. When you think about these issues, so what can we do? We try to always give recommendations. The number one tool to lift families out of poverty is the earned income tax credit. Back in 2011, it was reduced from 20% of the federal amount to 6%. That took $60 million out of Detroit. And when people who are low wage earners, when they receive that amount, they spend it in the local community. And you hear a lot of people talk about where there's fraud, things like that with that. The fraud with that is in the taxpayer filing of like having a parent who both husband and wife are counting the children. So it's in the filing itself, not in the actual earned income tax credit thing. So this is something, the number one thing, that tool that lifts families out of poverty. Also focus on 0 to 3. In the budget, 2014 and 2015 budget that starts October 1st, they included additional 4-year-old slots. And that's well and good. But what about 0 to 3? 85% of the architecture of the brain is formed in the first 3 years. We have to start investing in that as well, or at least giving flexibility to communities to allow them to use those funds. In fact, in that tax reform, have businesses pay more of their share, change how the methodology we use on how we tax. Do we tax sales? Do we tax services? The way the economy going, your higher income earners are doing more services than sales. Should we be taxing that more? So a lot of discussion needs to happen around all of these issues. And of course, you have to reinvest in people. That's actually number one. Restore the revenue sharing, things like that. So these are some of the things that we recommend. And we, the MML, the Michigan Municipal League, we kind of advocate with them on those key issues. Any questions so far? And I went through a lot of information. Those are policy areas I'm going to cover. But if you have any questions, I'm available. Actually, I'm going to have my card here too, so you guys can email me or call me if you do want to talk later. And one of the things that we also do is we actually have forums. We have forums twice a year. We have a convening, and then we have a forum. This year, our forum is Michigan's prison problem, mass incarcerations, its challenges and its solutions. And we have 4 awesome panelists who are going to share their information about it. Laura Sager, Kayla Mason from the Detroit area, Dennis Schrantz, and also Shaka Senghor. And hopefully many of you know him and his book. So we're looking forward to that. Hopefully it's end of next month, October 30th. I have to have a flyer about that as well. And hopefully some of you may want to join us for that. So I went over a whole lot of information. I think it's important that we all kind of dig in and we all kind of let our voice heard. I love this King quote: "Our lives begin to end the day we become silent about things that matter." So we all have to get involved with issues that are important to our community, our families, and to the stability of our families and communities. So thank you so much. Again, our website is mlpp.org. Sign up for email alerts. If there's something happening in legislation, if we have a blog out about something, you get email alert about it. I promise you it's not every minute. It's maybe two times a week maybe. So please sign up for email alerts. If you give me your email address, I can sign you up for that. And also is my website, my email address. So thank you.